Elevation Med Spa in Lone Tree, Colorado. We are going to be doing phase 2 of a 2-step treatment for Vinny's nose. Vinny had a scar here from a tennis racket. We won't go into details because it was self-inflicted. So I guess about a week ago or so, we injected some PRP into the area to help lift the scar a little bit and start to soften it. And right away, within a few days, a lot of the pink tint to the scar has gone out, and it is not as deep, not as textured as it was before. So today what we're gonna do is we're gonna go in and use one of the Allergan Juvederm products, and we're going to lift the scar a little bit more, and I'm also gonna put a little bit in the bridge of Vinny's nose to kind of smooth out the junction so that his nose is a little more tapered. I'm getting ready to put some BLT cream on, which is a combination of benzocaine, lidocaine, and tetracaine, which is a topical anesthetic, and this will just kind of help with the needle sticks. All of the Allergan products that we use have lidocaine in the product, so once we start injecting, it's fairly comfortable, but the needle stick itself, this is a really tender area, so we're gonna numb it up a little bit. Numb and got his skin all prepped and cleansed and ready to go. We are going to work with Voluma today. This product is actually a really good product for filling in deep crevices and along the nasolabial folds. It's also a great product for cheekbones because it is a long-lasting product and it's pretty viscous, it's pretty thick. So I think it'll be a good choice for working on the gap and the scar on the bridge of Vinny's nose. Work on correcting today is I'm gonna inject the scar a little bit, just to kind of give it a little bit of lift, and then we'll build in around that. Because that's truly the goal of this correction, is to fix that scar and make it not so noticeable. Okay. Okay, so now for the bridge of the nose, one of the things we have to be concerned about is there are a lot of blood vessels in this area, so we have to be very careful about any kind of occlusions. And so the way that we're gonna work to avoid that is to do a lot of wiggling of the needle here to make sure that we're not in any blood vessels here. If you were in a vessel, what would happen is the area would blanch. Okay, so we're gonna inject real slow. Doing okay? Mm-hmm. And as you can see, the bridge is already correcting. So what we're doing is we're playing with how, when you're using filler, what you're doing is you're trying to change how light falls on the skin. So we're playing with shadows, and what we're trying to do is to make this area of his nose even and a little more sharp and defined so that the light will fall on it, and will make any changes in the nose structure a little less noticeable. Okay, so now we're just gonna kind of touch up around the scar a little bit. And in very small amounts here, just in case there, heaven forbid, there was some kind of occlusion. Perfect, I think it's looking really good. Do just a little bit more right in the top part of the bridge here. Again, just adding product to change that lighting on the face. Vinny is going to be so awesome, his mom won't even recognize him. Which may or may not be a good thing. She might be mad at me for doing this, but I think it looks great. So, all right, turn your chin towards me. Perfect. Now we're just going to kind of come down the bridge of the nose and just, again, just add some sharpness. Okay, big stick. And the nice thing about these products is they're really malleable, so we can move them around and put them into the place where we want them to be. The other thing you want to avoid is over-correcting any one part, because then you find yourself going back and forth filling. Okay, turn just over. And the other thing you want to do is make sure you kind of stay in a straight line, because of course you don't want to give the illusion of a crooked nose. We're trying to just fix the profile of it. And stick it again, sweet pea. And then the tip of the nose is pretty sensitive, so here comes a big stick. Keep breathing, and you're doing awesome. Okay, so I think we are pretty much done with the nose. I don't want to do a whole lot more sticking, because I don't want it to swell, because then we won't be able to tell what's product and what's swelling. So we have a little bit of product left, so I'm going to kind of sharpen up Vinny's upper lip a little bit, make his cupid's bow more noticeable.